Endometriosis care is shifting to prioritize clinical diagnoses and symptom management over routine diagnostic surgery. This modern approach emphasizes detailed patient history and advanced imaging for diagnosis. The CUD-AMIS recommendations focus on non-invasive diagnoses through clinical history and systemic comorbidity consideration. Personalized treatment is based on age, reproductive goals, and disease phenotype, integrating long-term management strategies. This integrated evidence-based framework for endometriosis management highlights the disease's impact, the new paradigm's focus on non-surgical diagnosis and medical therapy, and the importance of a multidisciplinary team. We are transitioning from surgical diagnosis to a modern clinical radiological approach, with imaging technologies like TVUS playing a central role in precise phenotyping and clinical decision-making for endometriosis. Endometriosis-associated infertility involves complex mechanisms, including ovarian alterations, inflammation, and epigenetic dysregulation. Fertility care requires careful consideration due to the impact of the disease and potential effects of surgery on ovarian reserve. Endometriosis has a complex etiology involving multiple overlapping mechanisms such as retrograde menstruation, coalomic metaplasia, and epigenetic changes. This leads to phenotypic heterogeneity, including ovarian endometrioma, superficial peritoneal, and deep infiltrating endometriosis. Progestins are established as first-line therapy for endometriosis, offering long-term pain relief and prevention of recurrence. They work through mechanisms like endometrial glandular atrophy and suppression of cell proliferation, suitable for long-term use with no hypoestrogenism. Second-line therapies for endometriosis include GnRH agonists and oral GnRH antagonists. Antagonists offer rapid onset and flexible dosing, while both require careful consideration of side effects, such as bone density loss, and may require add-back hormonal supplementation. Long-term medical suppression, primarily with continuous progestins or COCs, is crucial for managing endometriosis as a chronic condition. Complementary approaches like yoga and anti-inflammatory diets are also widely used by patients for pain management and symptom relief. Surgical intervention for endometriosis in the context of infertility requires a comprehensive reproductive discussion. Mandatory surgery is reserved for organ-threatening conditions like ureteral, bowel, or lung complications. Surgical intervention for deep infiltrating endometriosis is indicated for pain that fails medical therapy, infertility with correctable factors, or disease-threatening organ dysfunction. Excisional surgery, when guided by imaging, can provide significant symptom relief in selected patients. Surgical limitations exist, especially for non-lesion-driven pain and ovarian endometrioma excision. Excision of ovarian endometrioma can reduce ovarian reserve. Alternative approaches, such as oocyte/embryo cryopreservation, are recommended to mitigate this loss. Long-term continuous hormonal therapy is the standard of care post-surgery to prevent recurrence and reduce pain by up to 60%. Discontinuation of therapy carries a rapid recurrence risk, highlighting the need for continuous management. Endometriosis recurrence is common, affecting 20 to 50% of patients post-surgery. Excision is superior to ablation for long-term outcomes, but may affect ovarian reserve. Innovative treatments offer better ovarian preservation and reduced recurrence risk. Endometriosis significantly impairs ART-IVF outcomes, with a 35% reduction in pregnancy rates. Successful strategies include deferred embryo transfer and cryopreservation. Early diagnosis and tailored therapeutic strategies are crucial to improve outcomes. Adenomyosis and endometriosis are systemic diseases with complex anatomical and vascular dysfunctions. They are associated with systemic comorbidities like heart disease and migraine, presenting clinical complexity that demands comprehensive care. Thank you for watching this video. For more information on women's health, contact Dr. Azer Links Clinic.